Good morning, I'm Sarah Davis, Director of Integrated Treatment Services, and welcome to today's seminar. Thank you for joining us. Today we're going to talk about top tips in helping with speech sound difficulties within the classroom. So that might be infant and junior age, as well as sort of children in their secondary school years who continue to have speech sound difficulties. So I'm going to run through some information about how you can help within the classroom, also how you might be able to help parents to support what you are doing in school to increase speech intelligibility. And I'll run through some useful resources alongside a little PowerPoint that you might be following now to give you some ideas and some visual representations of different approaches that may help. Okay, so a first top tip. One of the things that you need to be really mindful of is a child with speech sound difficulties. They need opportunity to practice and rehearse using words correctly. So first and foremost, I should say it's really important to have a child's hearing checked and to check that the parent has had the child's hearing checked and that they've passed. One of the biggest reasons for speech sound difficulties will very much be glue ear. That can be that they've had glue ear when they are an infant, when they're 18 months, 2, 3, and they may no longer have any ear infections in sort of latter years, but those early ear infections may well have interfered with the acquiring speech sounds, not hearing sounds properly. They may only hear sort of low frequency sounds, so not some of the hissy sounds such as s, and therefore they've replaced those sounds with alternatives, usually sort of something like a d and a t, that are louder to hear. So do check that the child's hearing is fine, and also to start with, make sure that you're aware very much around their sensitivities to their own speech sound difficulties. So some children in the early years have very low awareness that they're saying it any differently until somebody corrects them. And there's two schools of thought about this, is whether you should actually help them to understand that they have made an incorrect word or incorrect pronunciation of that word and what is the correct word. And sometimes it's best to just model back and give them opportunity to repeat it. So the first top tip, even though I've told you lots of things before this, is to really say take time to allow them to talk without finishing their words off for them, and also without competition of being interrupted by other children within the class. So if you can do that firstly, then as you hear a word that's incorrect, it's important to model it but not ask them to repeat it, because you'll find that children do actually then naturally repeat it back anyway. So if they said, my cup of tea, mummy, or my cup of tea is sitting on the table, you might then say, that's right, my cup of tea is sitting on the table. And you will find that when you actually start to repeat that back, children sort of spontaneously seem to then copy that sentence again. So in the early stages, particularly in foundation, it's really important that you actually just spend time modelling correct models of pronunciation and just naturally getting them to be able to sort of repeat back what you're saying without sort of requesting that they repeat it back. Now in time, when a child's actually undergoing some speech and language therapy for the speech sound difficulties that they're experiencing, we will then we call it confronting the sound error, to help them understand that the word they said had a different meaning. So for example, if a child is trying to say sea, like the seaside, but they say tea, we would have a picture of sea and a picture of a cup of tea, and as they say tea, we would hand them a picture of a cup of tea. So they realise that actually the pronunciation error that they've made has an impact on the word meaning that they've asked for. And once children actually start to be aware of that, then they start to change the phonological patterns stored. So the phonological patterns stored, it's like the consistency of using sounds in the correct places and knowing that's the correct place to use them. So some children will have stored them in a inconsistent way. So using a T for an S, that's stored as a pattern. So therefore it's about then raising that child's awareness that's got more established speech sound difficulties and helping them to put the right sound stored in their head for using S words, for example, storing that S rather than a T. So I think it's just important to note that sometimes when children are then going for speech and language therapy, or if you've got somebody advising you on speech and language therapy programs for the child, there may become a point where we would say, yes, confront the error and help them be aware that the error that they've used in their speech sound does have a different meaning. But in the early days, I would very much say, don't sort of make too much of a thing of it. Just model back accurate pronunciations. If you have children in the classroom that are teasing or picking up on incorrect pronunciation, obviously that needs to be managed, because insecurities and sort of shyness and embarrassment is going to make the problems of the speech sound difficulties worse for the child anyhow. So I think I wouldn't make too much of a point of discussing too much around, we don't correct, it's not like this, it is like that. I would more so say, no, everybody has a turn to speak. When so-and-so's speaking, you need to listen, and don't go into too much detail about the actual ability to correct something that was incorrect. I wouldn't labour upon that too much. So talking about some schemes that you're using at school, and obviously how this might link into the child with speech sound difficulties. So I know there's been mixed reviews about KTC and whether people prefer it to Jolly Phonics or Letterland or not. I actually have started using it with my 3-year-old twins, using number blocks and alpha blocks to support those sort of systems too, obviously the alpha blocks in this case. And I will say that what speech and language therapists will very much like now about KTC, and also some of the Letterland, the letter blocks programs with CBBS, is that it is teaching pure sounds. So something this leads me on to is making sure that the parents know how you are teaching speech sounds to children and how you're teaching it in literacy, because you will hear, as I'm sure you know, many parents will be saying things like t, or they will be saying s, that kind of thing, whereas we obviously know that s doesn't appear in a word, but s does appear in a word. And if you're trying to sound out a word, using s is not helpful. But if you've got it, then that will sound out that word and blend much more easily. So children are achieving better results with the KTC approach. So I would say, make sure that parents understand which phonics scheme that you are using, and really help them to understand that when they're actually pronouncing words for children at home, how is it that you want them to pronounce the actual pure letter sounds? How is it that you want to get them to blend? Helping them realise, which sounds are later to develop, later to come. And also in words, if you've got, say, a blend at the beginning of the word, like in train, that's a harder word than in tea, and therefore giving them a bit more awareness, and so they're not worrying so much about sort of some of the skills that will come later, but also giving them the best opportunity to actually model to their children the speech sounds in a pure manner, which is going to help you at school to help children blend words together. So another approach that we might use as speech and language therapists is something called cued articulation, and there'll be an image of that coming up on your screen now, and perhaps a short video or a link to a short video that you can watch. So cued articulation is very much around giving a visual method. So for those of you that like KTC but miss the Jolly Phonics in terms of the actions that helped children sort of assign a sound with one of the actions and sort of commit it to memory, cued articulation is an excellent way to support the KTC framework of being able to give children an action that will be associated to a speech sound, but also with very clear material related to that sound. So as an example, in Jolly Phonics, you use one finger for a quiet sound and you use 2 fingers for a loud sound, and we call them voiceless and voiced. So they know that straight away when you start to sort of put things like t and d together, and when you put s and z together. So we're showing them about quiet and loud sounds, or voiceless and voiced sounds, and we can represent that by 1 finger or 2 fingers. Then there's the direction of the airflow. So in cued articulation, you would use the direction of your hand, your finger, as to where the sound is coming out of the mouth and how it's coming out of the mouth. So that's, again, really helpful, because it helps children to learn the sort of the technique that they need to use to make that sound. And then finally, it will also show you the position, so whether it's your lips, whether it's a mouth open, whether it's spread lips. So the position of what your articulators are doing, that's also represented in the sign that you use. So for those of you that haven't seen cued articulation, it would be worth a look up, and it definitely would be worth asking your speech and language therapist to demonstrate it to you, if you do have some children that have difficulties actually with pronunciation, but also so you might learn it and then start to use it more of a whole school approach when using KTC phonics or your other phonic systems to support it. So do have a look at that video, it will come up on the screen. The other thing I wanted to do was to just highlight, given that we've talked about cued articulation, appreciating the difference between phonology and articulation. So phonology is the way in which the child has stored the sounds. They can make every sound in the alphabet. They are able to produce each sound accurately, but what they don't do is use the correct sound in the right place. So for example, the C and the T example, they can make a S, they can make a T, but they can't use it in the correct place. Now, an articulation difficulty is a child that is actually struggling to be able to physically produce that sound. And that's very different. It's a different approach we would use to work on the difficulties they're having within the classroom. So something to be aware of is if a child is having articulation difficulties, then what other approaches you might use or the speech and language therapist might introduce you to, it's going to help with that. So there's a very useful approach called Talk Tools. It's a US based approach, so it hasn't got a great degree of UK evidence base, but it's being used widely in the US and across other parts of the world. And there are lots of UK speech and language therapists using it and collating some evidence base in terms of sort of single case studies. But lost my train of thought. Talk Tools. Talk Tools is very much around helping the child to use the articulators that you would use in speech and for feeding in the correct manner. So it's not an oromotor approach, it's an oral placement approach, and that's quite important to stress. An oromotor approach is, you may have seen something called Mr. Tongue, or you may see some things where people are getting children to, point their tongue up to their nose, point their tongue down to their chin. Those approaches have very little evidence base to indicate that they're very helpful at all for children's speech sounds or articulation, because you don't use any sound where you put your tongue up to your nose. So it might be and you don't use any sort of feeding pattern where you need to put your tongue right up to your nose. Yes, you put your tongue out, but you don't put it up to your nose. So some of the actual oromotor approaches get quite a bad reputation now, simply because they're not patterns that are used in speech or in feeding. Whereas Talk Tools, you can see really clearly in the evidence base that the techniques that we're getting children to use in that approach is very much related to every single movement that they would need in feeding, and you need to have them correct in feeding to be able to use them correctly in speech. Now there's quite a high prevalence of tongue tie of late. Sometimes it's thought to be due to an increased amount of folic acid being taken in pregnancy, which produces more tissue, and therefore you get tissue attachment. So the tongue tie often needs to be released in the first few weeks as a baby, and sometimes re-released because it's reattached because it will regrow. So looking at the prevalence of tongue tie, there'll be lots of children that are having some feeding difficulties into their sort of toddler stages and into sort of, the infant ages. And therefore some of those things will also be having an impact on how the child is actually managing to then use their speech sounds. So you might get some lispy speech patterns, you might get very poor lateralization, so using the tongue to either side of the mouth, elevating the tongue, so using it in something like a L sound, that might be tricky for them to do. So if you get a chance to have a look at our Talk Tools, sorry, I just can't get that one right today. If you get a chance to have a look at our, yes it is, Talk Tools video, it would be useful to have a look at. Because that will give you an indication of sort of some other approaches, and they're really fun. The children really engage in them. You do need a speech and language therapist to actually assess them to see where they're at, but then the programs can be very much run by parents and in school and then reassessed by a therapist, a speech and language therapist. But they can be really successful for children that are having really difficult times in shifting speech sound patterns and getting them into their correct places. So being aware of the different approaches that are available is really important, because being proactive and asking your speech and language therapist about approaches that you are interested in seeing whether they could work or not with your students in school is important. So do feel you're armed with information. We've talked about making sure that parents know how you are encouraging children to actually make the speech sounds in themselves. But I think as well, beyond that, it would be really useful to give parents some materials to actually practice with and how they practice with them. Because otherwise parents are going to look to whichever source they can find. And if that's the internet or if it's sort of an app, you're going to find some quite Americanized approaches of pronunciations of speech sounds, but also then the semantic links that sometimes these apps put with speech sounds. So, something that doesn't really represent the sound very well, but it does represent what the first letter is. So you might use, I don't know, for example, you might use ring to practice the but it doesn't do a lot of reinforcing of just using the sound. And you might be better to then use, as the alpha blocks use in like the puppy, or I guess Jollyphonics did this, but the puppy rips a rag, So you're focusing on the sound and not the sort of the language link up with it. So do make sure that you can try and provide parents with any materials of how you teach phonics. And if there's anything sort of, whether it be flashcards, whether it be songs, whether it be the action sort of rhymes that you use, that they can reinforce at home, because otherwise parents will look to whatever is available. It might be worth encouraging that if, at the very least, if they're going to use something, the Letterblocks app might be the best one to stick to, because it is representing your sort of pure phonics used in KTC. Okay, one more thing on this. We were going to talk about, labelling around the classroom. So it's important to recognise, why are we actually using, why are we working on speech sounds? And obviously that's going to lead to not only correct pronunciation of speech, but then also reading and writing, so literacy skills. So I think it's really important that the child that's had some speech sound difficulties, they are going to be, struggling and having more of a challenge when actually learning to read these sounds, and also and the letters, and to obviously then write the letters. Different things is important, but also at the same time helping them with skills that overcome sometimes the breaking down and the decoding of sounds, of words using sounds, that may be slower for them because they're having such difficulty with pronunciation. So I would suggest also making sure that you do a lot of labelling around the classroom, and making sure that you have, what's the best way to describe it? Making sure that you have a lot of sight word opportunities. So for the children that are going to be struggling to sound out words quickly, they're also speeding up that process by becoming more familiar with sight words. So labelling around the classroom of things they see every day would be a really good way to help them with that. Okay, the other thing I've touched upon earlier, and just to talk about being aware of the language development, what I'm saying is, you want to ensure that despite the child having speech sound difficulties, their language isn't being limited. So when I worked in a speech and language therapy unit, we had some very severely dyspraxic children who really struggled to make any intelligible sentences, but had oodles to say. And when we started to use an approach called colourful semantics, we could actually see that these children were completely able to use sentences, and also to use the joining words. So, for example, if making an app was difficult, or those kind of little joining words, the conjunctions, they were able to still show that they had the understanding of these joining words by colourful semantics, even when the pronunciation of them between words was poor. So using colourful semantics can help you still to develop sentence structure, and help children to sometimes slow down a little bit in their speech without you needing to say slow down, because that's often not helpful. But it gives them a structure of, how to pronounce alongside the keywords in the sentence. But it also enables them to get messages across and to show that their language can be developed and develops further, despite having speech sound difficulties. So colourful semantics looks at using a colour system for subject, verb, object, adjective, and then beyond, looking at joining words in sentences, and then looking at some of the smaller joining words in between sentences. And because it's a visual approach, it's very easy for children to start to use this even when they're struggling with the actual pronunciations of speech sounds. So do look at the colourful semantics video if you haven't had any insight into what it is and how it might help. It can be very, very good to use alongside children and your literacy work when you're trying to still develop language production, language development, as well as focusing on some of the speech sound difficulties that they have. So I hope this has been useful. I hope that you've been able to follow the PowerPoint as we've been speaking, and also perhaps to stop and watch some of the other videos that I've recommended. Thank you for joining us today. If you do have any suggestions of topics that you would like to be covered, please do give us feedback. We love to make sure that we're covering pertinent content for you in the classroom, and we shall see you next month. Many thanks.